The next session, we have invited talks by two of our wonderful, esteemed new assistant professors. And so it's going to start with Alex Rodriguez, who will tell us about AI in public health.
Yes, Alex. Thank you for the invitation, and it's wonderful being here presenting my work. As you can see from the title, it's in AI for public health. I will be focusing today in epidemic forecasting. I will show you several AI projects motivated from this domain. What are some technical challenges that we have to face in order to do and impact this domain? And I also will talk at the end of the talk about a connection to responsible AI. How can the methods that we develop for this application can be useful towards advancing our understanding of our methods of responsible AI. So with that, let me first introduce briefly what are epidemic spread population. We all know probably that we have seen these images from COVID-19 cases where each circle represents number of cases in certain location. I will look this over time. We can see this, what we call epidemic trajectories or epidemic curves, and they are going to give us an understanding of the situation and also what is the outlook for the future. You may be thinking that this is already an old story, and we have moved on from epidemics and so on, but actually it's an important problem still for our society. Let me just give you some recent numbers for COVID-19 and influenza. For COVID-19, you can see that we had in some recent months 200,000 new hospitalizations and also more than 20,000 deaths. And for influenza, we had 85,000 new hospitalizations. And you may be thinking that maybe this is data for 1 year or more than 1 year, but actually this was only a bit more than 1 month, December 2022 to January 2023. So this is still an important problem for our society, and we have to do something. These efforts in order to combat the spread of diseases are being led by public health agencies around the world. For example, the World Health Organization, the CDC, and also here in Michigan, the Michigan Department of Health and Human Services. And there are some tasks and decisions that they care about. For example, as I mentioned before, we have situational awareness, and we have also forecasting. And this information is going to be useful for them to take decisions like resource allocation or individual risk assessment and so on. Today I will focus on forecasting. Let me just show you one real-world example that we face in COVID-19. In x-axis we have the time, the epidemic week, and the y-axis we have the number of weekly deaths. And you can see that in the epidemic curve that we can see here, maybe the trend is going down. You may be thinking that the future of this trend is going to go down, but in reality what happened is that it went up. You can see that the red one, and this is very challenging to predict. There are multiple factors, as you may have experienced during the pandemic. We had to look into multiple other indicators, for example, the number of infections, or the contact patterns in the population, or also the number of people experiencing symptoms. And many of these are coming from data sources that are more recent, more novel. For example, SafeGraph has mobility data that is a proxy for contact patterns. Facebook is going to give us some online surveys of people experiencing symptoms. Google is going to give us some symptomatic searches. Kinsa is going to give us people experiencing fever in certain localities. And many of these data sets have been proven to be of greater sensitivity, granularity, and timeliness of traditional sources in public health. In addition to that, we have also more availability of them thanks to the recent interest in this domain. So the vision of my work is to enable data-centric solutions for public health, where we can connect data to decisions through predictive modeling. And here, the take that my work, or the approach that my work takes is deep sequential models and also scientific machine learning. And I will talk today about two challenges that we experienced, and I will develop two pieces of work in this domain. We have been testing these methods even before COVID-19, influenza forecasting, and then we jumped into COVID-19, and also we showed successes in using deep learning methods for epidemic forecasting. We were among the best performing methods. I will show you some of those two components that we identified that were important in order to do well in this application. The first challenge that I want to talk is about leveraging heterogeneous multimodal data. Data in this domain is scarce. You may be familiar with computer vision datasets, for example, the CIFAR-10. We have this many images, but in flu and COVID, we have much less data. There are also some shifts in data distribution. For example, before the vaccine, if you had some increase in mobility, it was clear that maybe it would be represented as an increase in number of hospitalizations. But after the vaccine, this was not clear. This was more nuanced, more complex. A second challenge that my work addresses is how to bridge data and existing epidemiological knowledge coming from scientific modeling. My work advocates the use of causal mechanisms discovered in scientific knowledge in epidemiology in order to answer qualitative questions and what if counterfactors. And if you were going to open this EPI 101 book, you will find what is called as mechanistic epidemiological models, which broadly speaking, we can think of two classes. One is ordinary differential equations, like the SIR model that you can see here, where we have people in each of these compartments, and in each, for example, the compartment S is going to represent the susceptible people, the healthy people, I is going to represent the infectious, and R is going to represent the recovered people. And then we are going to be having these equations that are going to be representing how people is moving from one compartment to the other. If we have initial conditions and also we have data, we can also solve this, and it will look something like this. And in other hand, also we have agent-based models, which comprise a collection of agents which are going to be acting and interacting within a computational world. And diseases will be transmitted across these multiple layers, where we can see the contact layers for workplace, household, and schools. So my work is trying to connect with these methods in order to make our models more trustworthy, and also take advantage of, as I mentioned before, more to the mechanisms that they have in order to enable what-if questions, counterfactors, and so on. So I want to emphasize here, in addition to what I said, there are also other ways how mechanistic models can help in our AI models. And here is an example with COVID-19, where we are seeing the Delta wave and the Omicron wave. For the Delta wave, we saw around 100,000 number of cases per week. And for the Omicron wave, we had 3 times that number of cases. So if we have one neural network that is going to be making predictions for this epidemic curve, and this is a mortality epidemic curve, so we want to make predictions for mortality, we are usually going to be using cases as an input. And if we have a neural network, we are going to be making predictions something like this. Because now we have many more number of cases, and before we haven't seen such a large number of cases. Neural network predictions are going to be overestimating what the actual number of deaths should be. So you can see that in the short term, actually these predictions are reasonable. You can see that they have a good trend, and also they are accurate enough. They are useful. And we have seen this constantly also across multiple challenges in CDC. For short-term predictions, usually these machine learning models usually perform well. But when we are looking into long-term predictions, for example, from 5 to 8 weeks, they are missing something clearly, right? They are missing something that probably the mechanistic models have. Probably they have this structured knowledge that can be a useful addition to these neural networks in order to make these predictions or long-term predictions. In addition, also, there is another facet. Another facet is how can AI methods can help mechanistic models. If you have worked with mechanistic models, for example, based on differential equations or agent-based models, it will be non-trivial to add data sources. For example, if you want to add the Facebook data or the Google data, it will be adding some overhead complexity, and it will be even laborious also to do this, the calibration also. And the calibration is going to be complicated and cost prohibitive. For example, if you have you make a small error in estimating one parameters, it can give you very, very different outcomes. In addition to that, it can be very challenging to calibrate a large model, for example, a large agent-based model for one city or for one state. So this is also something that can be facilitated. For example, the first one can be facilitated by machine learning, by automatically learning patterns and how these can be adapted to these mechanistic models. And in the second one, we can use ideas for machine learning like gradient-based optimization in order to improve the efficiency and also the speed, the scalability of the calibration of these models. So there are two methods that I will present briefly today. First is based on the idea of incorporating dynamics of an ODE into neural networks. You can see in the figure that we have this SIR model, and we are trying to extract what is useful from it and put it in a neural network. And a second idea is incorporate neural networks into the mechanistic calibration so that the neural networks can ingest data sets from multiple sources, multiple modalities, and inform the calibration of these the parameters of the AVM or the AGM-based model, and also help with the gradient-based gradient-based optimization. We can also help the efficiency, the effectiveness of finding good parameters for the AVM. How our proposal is different? We are working under the umbrella of end-to-end learning with mechanistic models, where traditionally we had data parameters to parameters from mechanistic models and mechanistic model to epidemic forecast. But now we are proposing to have from data to epidemic forecast, where we have neural and mechanistic components being interplaying there and interacting. And in addition to that, we can now, as I mentioned before, we can incorporate multiple modalities. We can have a neural network, for example, for images, for CNN, or we can also take advantage of some techniques that we have in deep learning, like transfer learning, and we can take it, use it here in order to make our predictions and also the use of domain knowledge more effective. And we can also take advantage of gradient-based optimization. This is the second quote of Jan LeCun you will see today probably. And Jan LeCun and many others agree that gradient-based optimization usually is more effective than gradient-free optimization. And we can also take advantage of packages and computer architectures that we have seen that in deep learning that haven't been explored in these domains. So now I want to briefly elaborate these two ideas. The first idea is, as I mentioned before, the problem is AI needs mechanistic models, and the idea is to incorporate dynamics from an ODE into neural networks. And here you can think of teaching a robot what are the basics in epidemiology. And big picture idea is how we can connect time series data to latent ODE dynamics. And latent is because there are many states of this, the dynamic states of this ODE that are unobserved. For example, you can see that the green one, the M is the only one observed, and the blue ones are unobserved. And this is this diagram, we are representing what is known as a physics-informed neural network. For the specific differential equation that we have here, it will take time as an input, it will have a multi-layer perceptron as a neural architecture, and it will output this, the complete ODE dynamics. As I mentioned before, some of them are latent. So we usually train them by just computing, or training by minimizing this loss. We have to also compute this derivative. There are multiple details here that, due to time, I will not go into, but I want you to leave you some what we have done here in order to make this work. First, there are some problems with this approach. First, the time is not informative about the future. So we have to put some other input. We have to put some more informative information that input, as an input for a neural network. What we are proposing here is to add these data features. In addition to that, change this multi-layer perceptron for a more appropriate architecture that is going to handle time sequences, time series data. And what we have here is a deep sequential model. And in order to do this, with physics-informed neural networks, there are some challenges that you have to overcome. And what we are proposing in this paper is a method, a new way to incorporate this into the physics-informed neural networks. Another problem is how we can, the second problem that I wanted to briefly discuss is how mechanistic models can help AI. How mechanistic models can be helped by AI. And here, as I mentioned, the idea is that we have neural calibration of agent-based models. And traditional agent-based models, they will have some agents, some networks where they are going to be interacting, and you will have some parameters as an input. You can see in the left, there are some parameters that are going to be governing the transmission and progression of the disease in the simulation. And you are going to be running this, it's called forward simulation. You will run this for multiple days, and you will get this, what is called epidemic curve in the right. One challenge, as I mentioned before, is calibration. Calibration is basically finding the parameters that you can see there in the left. This is a difficult inverse problem. And in addition to that, as I mentioned, it is hard to incorporate data sources. So what we're proposing here is to reformulate this agent-based model in order to make it fully differentiable. And by making it fully differentiable, now we can incorporate neural networks, for example, easily. We can also do gradient-based optimization. I will show you that in a moment. But these neural networks are going to be helping us to incorporate data sources from multiple modalities, multiple sources. And they are going to be predicting you can see number one, they're going to be predicting these parameters that we want to estimate. In number two, we're going to be doing is forward simulation forward pass or forward simulation over multiple days. And number three, we're going to be aggregating across multiple days. And number four, because we have the ground truth data, we can also backpropagate and learn basically the parameters of the neural network. So the neural network is going to be helping us to calibrate this agent-based model. And the agent-based model has been reformulated, as I mentioned. So there are some technical details there in order to make this happen as well. If you are interested, the paper is available there, or we can chat later. And in order to close this presentation, I want to talk about some opportunities based on this work for responsible AI in public health, specifically motivated for public health, but they can be applicable for others as well. The CDC, they collect data from only some selected hospitals that are willing to volunteer. So these hospitals, usually they have more resources. They will be more well-equipped in order to comply and send data to the CDC. These hospitals, therefore, are going to be serving usually more affluent populations. So that is something that here is where we are missing a data bias problem is that there are some populations that are underserved, that they are not going to be captured by the data that is collected by the CDC. Therefore, there is an opportunity here for population-aware AI systems in order to incorporate this knowledge about the demographics, the dynamics of the population, and correct these biases in the data that is inherited. It's very hard to actually tell the CDC, please correct these biases. They will tell you, no, we cannot do this. It's very challenging for us. We cannot push people to do this. And another piece of work that I would like to emphasize that is maybe important for responsible AI is the use of differentiable simulators. I mentioned here that we had some differentiable simulator or a differentiable agent-based model, also broadly speaking is known as differentiable simulator. We can go from data to epidemic forecast and from epidemic forecast to decisions. We can take advantage of some new advances in decision-focused learning or differentiable optimization, also known as differentiable optimization. And we can take from data to decisions as I mentioned, with the differentiable simulator and also the decision-focused learning approach. And we can optimize our predictions in order to be more useful for the downstream decisions that we want to make, for example, equitable resource allocation. And conclusions, I want to mention that I want to just, hopefully I convince you that the data-driven expressibility of AI is useful in public health. Public health motivates new AI problems and new solutions. And also there are some nice avenues for collaboration. And I want to acknowledge my collaborators and thank you for your attention.
Thank you very much. I think we have time for some more questions. I'd like to start out with a question. In many ways, infectious diseases is one of the existential threats for our society. And in many ways, COVID, which has been such a traumatic experience for all of us, has been a trial run. The next one could be much worse. So now you've done all this very sophisticated work connected with COVID. How should we be ready for the next thing? Is this providing a technology that would set us up to be able to respond to the next thing, which might have different properties, and we have to be covered?
Yes, thank you, Ben, for the question. This is definitely going to be helping us because, as I mentioned, I made emphasis in the incorporation of novel data sets. In the future, we are going to also have even different data sets that are going to be coming from other sources of data that we cannot even imagine right now. So we need ways in order to take advantage of them, leverage them, and also take advantage of domain knowledge in epidemiology, as I mentioned before, right? So we are definitely preparing ourselves for this kind of scenarios.
So this is super cool, and I also like the fact that you engage with the CDC. I'm thinking, I would imagine there are many places around the world where maybe there is no such thing as CDC that would do all the legwork to get people together. So what are your thoughts on how ideas like this or models like this could be applied in other places?
Yeah, I think it is a very important problem. very important concern. I think that we have to have, well, these models sometimes are focused on the US. For example, the demographic data that we have here is from the US. And sometimes when we go to other places, it is not available. So we have to make some assumptions. There are some things that we have to do. But I think in general, I think I am positive about that. I think we have to explore more that domain. And I want to also say that there are multiple, regarding to what you said, there are multiple other places where they don't have the CEC, they don't have even data or good quality data. So these methods can also help us to overcome these data quality issues because we can take advantage of what we are learning in other domains or other countries which we have a more sophisticated public health system and bring some kind of transfer learning or transfer some of the patterns that we are getting in order to overcome the challenges in other countries which have less resources. So I think that will be maybe a good way to proceed on that.
Last question.
Thanks for the talk. So I have a question. What do you think about like this fundamental limitation of either artificial or AI tool or either mechanistic model? Because they're learning the knowledge from experience, which from the history, instead of knowing what's going on, which is the input, which I think is very important for those kind of predicting future, right? So how do you think there's any advanced way for us to able to even getting more knowledge from what's currently going on, but not just learning from the past, from the data? Thanks.
Yeah, I think it's a good, you have to do a balance there. You have to have a mechanism that it can balance if you rely more on the historical data or you rely more on what you are seeing currently or the expert knowledge that you have about maybe if it is very uncertain, you have to rely on some other resources, for example, the models I presented today. So I think it is an important problem that you have to do some balance there. And maybe with attention mechanism can be helpful there, something like that, right? But I think it is maybe a more sophisticated solution will be more interesting, I think. But I think it's a very good problem to think about.
So thank you very much.
Yeah, thank you.